Hi guys, my name is Trista Vaughn and I am the graduate coordinator on the Broken Arrow campus, and I'm just going to be the monitor for this MPH virtual info session. So if you guys have any questions, I'll be happy to answer them, and if anyone else wants to jump into the questions, please do. We'll take questions at the end of this virtual fair or virtual info session. So Dr. Middleton, if you want to take it away.
Good afternoon. Thanks for that introduction. Please don't forget, Trista, to record this for the people who couldn't be here today.
Okay, it's a recording right now.
Okay, thanks. So as Trista said, I am Dr. Wendy Middleton, and I'm the MPH Program Director here at NSU. And today I wanted to provide you with a little bit of information on what an MPH degree is, what types of jobs you could possibly get with an MPH, and why you should consider pursuing your MPH here at NSU. Then my colleague, Dr. Tracy Freudenthaler, will tell you a little bit about what we actually do in public health. So you get a little bit of both sides. Let me share my screen with you real quick. I think I'm sharing the right one. Can you see anything or no? How about now? Can you see my PowerPoint? Thumbs up. All right, thank you. Give me 1 second. All right, so what is an MPH degree? An MPH is considered a graduate level professional degree, and it focuses on things that we do in the real world. So not just a textbook application, but actually what individuals are looking at out in the public arena. So students pursuing an MPH learn the fundamental principles of public health, and they actually gain hands-on experience in addressing a variety of different health issues, both in the virtual classroom as well as within the community. So we actually provide you with that hands-on experience as you go through our program, so that when you graduate, you're not just at a loss for what we really do out in the real world. So some of the careers that you can get include things like research scientists, directors of community health programs and services. We also have health communication specialists. Pretty much you can do just about anything with an MPH. And the Bureau of Labor Statistics states that within the next 10 years, the number of careers in the field of public health is going to grow faster than any other profession. So there's going to be a lot of jobs available. So you should definitely think about the online MPH here at NSU, mainly because our program is 18 months long. We are based out of the Muskogee campus, but like I said, it is an online program. So you take 43 credit hours in the didactic portion. So all of your actual coursework is online and it's asynchronous. So you can do it at your own time, your own pace. You can be a full-time student, you can be a part-time student. So what that means is you can take 12 hours a semester, or you can take 1 hour a semester. The choice is yours. So you really never have to come to campus. You just log on, talk to your professors online. We're always here to Zoom with you. We're always a phone call away. Or if you wanted to meet in person, if you're close to Muskogee campus, we could do that as well. So as you're going through our program, you'll do what's considered a practicum. And what you actually do is work in person with people out there in the real world agencies doing public health work. So you will get not only the hands-on experience through your coursework, but you actually get to go out there and do the work itself. Most of our courses are only 8 weeks in duration, so they go pretty quickly, but this allows us to offer our rigorous program and remain competitive with other programs that are out there that typically take 2 to 3 years to complete. So we're very fast paced, we're very rigorous, but you get done faster. So you get to those jobs before anybody else does. Currently, we do offer 2 concentrations for our MPH. We have global health and we have public health, public health leadership. Our core courses focus on those rural, culturally diverse, and underserved populations. And we teach a variety of different things, including epidemiology, biostats, public health interventions or program planning, and we also teach program evaluation. So in addition to that, you do research. So you get pretty much a wide variety of experience from beginning to end when it comes to public health. We also offer public health certificates. So if an MPH isn't the right path for you, or you're not sure if you want to get a full master's degree, you can get a certificate in either public health leadership, or global health. In addition to that, if you decide you wanted to get, say, for example, an MPH in public health leadership, but you're really interested in those global health courses because you want to brand yourself a little bit more in that arena, you could get the MPH in one and then get a certificate in the other. So you'd have the best of both worlds that way. So our criteria for admission: you have to have a bachelor's degree. That's first and foremost. So you have to graduate from an accredited institution. You have to apply and be formally admitted to the graduate college. Have your transcripts sent directly from that institution where you did your undergrad. Usually you'll get an email once you apply from the graduate college, and I know they're working on changing some of how they actually notify you, but you'll get a notification saying that you've been accepted to the graduate college and that your application has been forwarded on to me for review at the program level. We do require that you have a 3.0 for regular admission, but if you're slightly underneath of that and you really are passionate about public health, then we can talk about it. We can see where your passion actually lies. We do offer conditional admission. So if you're not quite where you need to be, we can start you out at certain courses to help get you where you should be. We also ask that you submit an application packet specifically for the MPH program. So this is basically a supplemental essay questions that allow us to gain a little bit better understanding of why you want to pursue an MPH. We also want to make sure that there's a good fit between you and our program. So we don't want you to come to our program if it's not the perfect one for you. If there's another one out there that's better, I'll email you and say, hey, have you thought about doing this? Because it seems like your passion is more this than it is public health. So things like that we consider. We do have admission deadlines. So for fall admission, our priority is April 15th. And for spring admission, our priority is October 15th. So priority means you get your application in by October 15th. You are pretty much guaranteed a slot, provided you meet all of the criteria. We do have secondary application deadlines. So if you can't quite make it by October 15th, as long as we get it by mid-November, I do believe it's November 15th actually. Oh, December 15th. If you get it to us by December 15th, sorry about that, then we will make sure that your application is reviewed. And if there's a spot available still, we will get you in there. And if you have any questions, please don't hesitate to contact me either by email or phone. Both are listed on the screen for you. And with that, I'll turn it over to my colleague, Dr. Tracy Freudenfelder.
I am excited to be here. Thank you for sharing your lunch break or your early part of your afternoon. I am going to screen share some slideshow with you in just a minute. I have had an MPH degree for several years, always passionate about giving back to my community, wanting so much to find ways to meet needs for women and children and their families. So that gives you, a little bit of a background about me. When I think of public health, I think one place to start is to think about how would we strengthen the community around us. I think it's kind of understood, every part of our day-to-day lives are within our neighborhood communities. It's where we live, it's where we work, it's where we play, even where we pray for many of us. If you had an MPH degree, you would know and learn in our program, you'd understand how to conduct public forums in that community. You'd be linking within the community with decision makers and leaders to provide services, whether that's health clinics or free groceries. It might be education for a variety of different topics. In our classes that you would take in our program, you learn how to design healthy community, I know with an MPH, I've always been very, very active in my community. I've joined activities of different volunteer organizations. Again, just the spirit of giving back and promoting health and wellness has just been a really an integral part of how an MPH would take action in their community. Sharing resources, sharing ideas, all of those things come into play when you think of MPH. But Dr. Livingston and I often get asked, well, what exactly is an MPH and what do you do with an MPH? And so I want to be interactive with you just for a few minutes. I think that many people already know what public health is or community health and just don't really think about it. So let's play a quick little trivia game. I am going to ask you a trivia question and give me a thumbs up. I know we have a few people that I don't see your video, but you can certainly please use your chat room if you'd like when you think you know the answer. Again, thinking about strengthening community, there's a TV show that I'm looking for. So give me again a thumbs up or use your chat box when you think you know the answer. This TV show has won over 200 Emmy Awards. This TV show is in 40 languages and in over 100 countries. This TV show has been on the air for 50 years. Does anybody have any guesses so far? Got a thumbs up here. Okay. This TV show was developed by psychologists and they consulted with pediatricians. All right, this next clue is probably going to give it to you. I'm still waiting for Emily and Blake and maybe Ethan to chime in here. This TV show champions children's well-being in their neighborhood. Any guesses? I've got another thumbs up. I've got a smile from Trista. Well, here's one final clue and then I'll give it away. This TV show has broken cultural stigmas and boundaries by having puppets as actors that are every different age, every different ethnic background. They even include in this TV show Muppets or puppets that have different emotional or physical challenges, and they've incorporated that into their educational lessons that come. So Ethan, Blake, Emily, do you have any guesses? I can't see your chat box at this particular second. I've got a thumbs up from Sesame Street, like you were right, you were right, you were right. Thank you for that. Yeah, Sesame Street came on the air in 1969 with a very bold question. How can we use television to educate kids? But the format relates so much to public health. It's just very, very striking. We're actually going to go to Sesame Street right now. We're actually going to go to Sesame Street. If you know how to use Zoom to annotate, we can try to do that, or again, use your chat box. This is literally a real live version of Sesame Street. They have one in Florida and Pennsylvania as well. When you look at your screen in front of you, I need to call for me. When you look at the screen in front of you, what do you see here in front of you that means that children and their families have opportunity to be well, whether it's physically or emotionally? What do you see here in this environment, in this community that represents health and wellness to you or opportunities to be healthy? I'd love to have people chat or even unmute if you feel comfortable to chime in. Bree says sanitation. Bree, where do you see sanitation? Where do you see that?
They have recycling bins, and then my favorite character was Oscar the Grouch, who's in that little trash can over there.
No, that's perfect. When I think public health, part of public health or community health could absolutely be sanitation and environmental health. So that's a great thing to start with. What else do you see? Bree or anyone else? What else do we see that represents opportunities for wellness and health in the community? Krista, how about you?
One thing that stands out to me, because I kind of have a green thumb, I'm trying to become a plant mom, so I see the plants right there, straight ahead. So I
I love it. I'm going to show you another screen real quick where this green space right here, Big Bird's Nest, truly represents this opportunity to get outside and play, to literally have green space in a community that otherwise has a lot of concrete. But yes, Trista, you're right. Plants, agriculture, gardening certainly come in to community wellness. Having that opportunity to have a community garden, having an opportunity to get outside and be physically active. If you remember the theme song for Sesame Street, it was very upbeat. And for mental and emotional health, it's interesting to think of building an environment where you have a balance between the apartments and then these opportunities to have parks and playgrounds for the children to be outside. I'm going to go back to that first one here. If you notice a grocery store over here on the left-hand side, unfortunately, in the state of Oklahoma, we have a lot of food deserts. I won't give you the technical definition, but I will imply that many families in the state of Oklahoma are driving 40 or 50 miles to reach produce, to reach fresh meats, to get groceries that are outside of the dollar store type of setup. So think about that from a public health perspective. Children who grow up with access to a convenience store is one thing. Children who grow up with access to fresh produce and different varieties of farm fresh options, that's pretty interesting. I'm looking at this, and again, not trying to talk too quickly with my raspy voice today, but if you look, I see a lot of safety things that are in place here in our built environment. I see street lights. Can y'all see me wiggling the mouse? Oh, perfect. I see street lights right here. I see safety fences and gates. There are hand rails here with a little sliding ramp so that there's different levels of accessibility across the area. Switching over here, I see an area for us to have wellness and hygiene, just those feel-good days at the spa. So again, talking about self-care. Now this is silly. I literally had someone ask, well, how in the world is having a theater? How is having a movie theater part of wellness or public health? Well, the movies themselves ain't the message. It's the fact that we are social beings. It's the opportunity to engage in arts, to meet other people in your community for fun activities or cultural events. So any type of entertainment for us that's initially just for that feel-good moment really can be an opportunity for children and their families to have bonds and connections. And it's also a great avenue for information sharing when you bring people together in these community forums. Skipping again. I want to show you again Sesame Street. The other pictures that I showed you were gorgeous, but they were very edited. This right here literally is in Pennsylvania. This is a Sesame Street. And again, thinking of what's public health and what all does that encompass? It's access and transportation. It's having policies for safe streets, maybe a bicycle lane, making sure that your roads are well lit and safe for your children, having crosswalks, all of those things build healthy communities. Thank you for letting me introduce this idea to you. I'm going to stop the screen share real quick and just come back to my face view. Dr. Middleton and I, again, often get asked, what is public health? What can we do with a public health degree? Your coursework in this program can be scripted, where you take this class and this class and this class, but the things that you're passionate about can be incorporated into your class projects. So if you're passionate about physical education and nutrition, you can build that into one of your research projects. If you're more interested in the environmental and sanitation part of community wellness, that could also be something that you volunteer with, or maybe do a campus survey with Dr. Middleton or I, talking about what would it take to have a healthy college campus. Thank you so much for letting me share these ideas. I hope I've piqued your interest and planted a couple seeds that public health is not a prescription, rather it's multiple different avenues of keeping little kids and ourselves very well, very healthy. I see that we have a student chiming in right now. So when she does, I'm going to use that as an opportunity to turn it back to Trista to welcome her in, and we can revisit some things if we need to.
Alrighty, welcome guys, and thank you guys so much for that presentation. And again, if you guys missed this, this is recorded. We're going to be sharing this on our Facebook page, and I will be giving it to you, Dr. Middleton, if you guys wanted to share on your website. I know we have an events page on our website, so I was planning on using it on there to direct people if they can't log on Facebook. The people who weren't able to attend, I can send them an email saying, hey, here's a link to the recording of today's info session in case you missed it. And I did talk to Carrie, and I'm going to share my screen with you guys too. One second. And let me see if I can share this with you guys. And we are going to be giving people who attended today a waiver for your application. Since you guys are here today, the code is webinar and the W is capitalized. And if you're not able, I'm going to put it in the chat here. So in case you want to copy and paste that and save that for later. And where you apply the code is at the very end of your application before you hit submit. There's going to be a small box that says apply code, and this is where you will put the code webinar in there. So I'll give you guys a second to get that taken care of. And again, this will be on our Facebook page and our website, and I will be sending out kind of reminders on the people who did want to attend but couldn't, to say, hey, missed you, here's access to the virtual info session. Dr. Middleton, did you guys have anything else you wanted to add in before we end the session?
I'd just like to invite questions from any of the audience members or guests that we have today. If there's anything they would like us to revisit or just questions we didn't address, please let us know.
It's a question, but it's also something that I thought was really cool is that, so I'm a current student in the MPH program, and I'm also working at the graduate college for admission. So if you apply, I would love to help you guys with your applications. My name is Bree Cook. But I thought it was really interesting in our first class, Dr. F talked about some of her background in MPH and some of the things she's done. So it was really helpful for me to kind of show me like what our faculty has experience in, if you guys wouldn't mind sharing some of the things that you guys have done as public health professionals.
Sure. So mine is a little bit different. I'm not the personal health expert that Tracy is, but I study tick-borne illnesses. So I look at what people know about them and what steps they actually take to prevent contracting an illness. And then if they have already contracted one, what are they doing about it? How are they preventing further degradation or further complications because of that? I'm also looking at obesity, especially in the state of Oklahoma. As we know, obesity is increased significantly, especially among the younger generation. And so how can we as a society, we as public health professionals, try to combat that? What are the steps that we can do? What do people already know? What are they doing? And then how can we use that as a foundation for new programs that are more effective for that younger generation? Because the younger generation is always online, they're always connected. So how do we relate to them a little bit better? So that's my two areas of interest.
I love that it's that your expertise, Dr. Middleton, shows the diversity of what an MPH program can do for our students, because like I had shared, it's not a prescription that you can only work in a health department or that you can only work in a hospital. I've worked in hospitals, I've worked in clinics, I did a lot of women's health, women's reproductive health research, STD education, that sort of thing. But I've also been able to work with just a lot of different type things too, having this degree and these experiences. So briefly, some of the work experiences, like Ms. Cook was asking us, is I have done vaccine research, drug research, research and development, literally for protocols impacting healthcare. When you and I would go to the doctor, I've worked on things like that. HPV, human papillomavirus, is a pet project that I've always had for the past 6 or 7 years. I love, you can see my apothecary sign in the back. I love historic medicine. I love understanding how we have had a timeline of different attitudes and perspectives in medicine and healthcare. So that is a research area that I have, as well as substance and drug abuse among college students and among our high school students. I don't know if you know this, but vaping right now is still very rampant. And when we ask students that are in high school, are you smoking cigarettes? Are you vaping or nothing at all? It seems like the trend right now is really heavy towards vaping. So those are things that pique my interest. If you did a Master of Public Health, you do not have to be a researcher. It's not, again, a prescription, but it's really interesting that the things that you're passionate about in our program, you do have that opportunity to ask those questions, learn how to find answers, find programs that are in your community, even if that's in a different state or a different location than where we're located. But you have those opportunities to ask those questions, see what's being done, and find ways that you can be a part of a solution. And I think that that's probably where I'll stop my chatter. Being part of solutions has been probably the biggest give that I can do for my students, is helping you link with the things that you're passionate about and finding ways to be an advocate for either those people or those groups to promote health and wellness. Thanks for that question, Bree. I think that's really, really helpful. I see a question in the chat box. Dr. Middleton, I'll give that to you. Emily is asking, is the GRE required to apply?
It is no longer required. We did away with that for last year or this incoming year. So right now, I don't know if it's actually all the way through the steps, but I am still writing waivers until that has been finalized. So no, you do not need a GRE.
Emily, you don't have to unmute if you don't want to, but I'm curious, what is your major now? Or what is your specialty area now? If you want to type that to me or tell us, that would be great.
I have a bachelor's degree in nutrition with like a concentration in allied health. So yeah.
That's awesome. We have students that come in with a bachelor's. I know that the GRE is required, not required now, but we do have to have a bachelor's from students. But we have students that have psychology degrees that enter this program. We have students with allied health and health professions backgrounds too. So that, again, is not something that is prescriptive. How about you, Blake? Do you already have your bachelor's, or you, Abigail?
This is Abigail, and I do have a bachelor's in cell and molecular biology with an emphasis in research.
Blake posted he has a degree in psychology.
That's perfect. I hope that I spoke to maybe a question that was on the student's mind is, again, is there like a prerequisite of a certain type of bachelor degree before you come into the program? And no, that's not the case. We have a diverse mix. And actually, that's exactly what we want, because with an MPH degree, as you're in your community and you're providing services, there needs to be different viewpoints and different vantage points. So we really appreciate when students come in with different backgrounds.
And I should add, my background is actually in microbiology. So hence the ticks, it kind of fits with my biology and microbiology. I actually studied the antimicrobial properties of a carrion beetle during my master's degree. So still in line with bugs, still in line with public health, but that's where I hail from, I should say.
Did anyone else have any other questions before we log off for today? Alrighty, and again, if you didn't see, we have the webinar code in our chat. And again, the code is just webinar with a capital W. And I think this was such a really good turnout, and thank you for your guys's, helpful information. And that'll be it for today.
Thank you for joining us.
Thank you.